COVID. It seems like it's back. The fresh spike in infections across India has brought the virus back into the spotlight, while numbers are still relatively low. The alert levels are rising, especially after 9 confirmed deaths reported across Karnataka, Maharashtra, Kerala and Jaipur. India currently has 1,009 active COVID cases, of which 752 are officially confirmed. 305 have already recovered. But what's really triggered the concern in recent fatalities? As we know, there have been a few deaths that have been reported, and that's really sparked a little panic. The ICMR chief, Rajiv Bahel, has said there's no need to worry though, because those people who succumbed to COVID this time were, in fact, they had underlying comorbidities, they had issues already, pre-existing health conditions, and that was the reason that COVID acted as a disaster. Now, here are the most affected regions. If I could take you through across India, Jaipur, in the latest, we hear 2 deaths have been reported in Jaipur. That's sparked fresh concern. Both are under probe for a possible new variant. One, a semi-conscious man who was admitted to the SMS hospital on May 9th, died 2 weeks later after trying hard to revive him. The other, a 26-year-old TB patient at a private hospital. We understand that genome sequencing was also tried, but unfortunately 2 died in Jaipur. India had recently detected variants of NB.1.8.1 in Tamil Nadu and LF.7 in Gujarat under WHO watch, but not linked to severe illnesses. Those variants, so far that we hear that have been found in India, are not severe in nature. Kerala also topping the chart in active cases. Total infected in Kerala at this point, 335, while recovered are 105. Unfortunately, 2 people have died in Kerala. Both deaths were men aged 59 and 64 years of age. In Maharashtra, highest deaths in this surge, as we know, total infected in Maharashtra were 300. New cases in the last 24 hours are 43. And unfortunately, in Maharashtra, 4 people have died of COVID-19. All had comorbidities, underlying health conditions. Now we hear most of the new cases are coming in from Mumbai. That's basically largely the epicenter in Maharashtra. Mumbai has recorded the most number of COVID cases. Apart from that, Pune. Delhi then, we're looking at a sharp rise in Delhi as well. Active cases at this point in Delhi is 104. That's a spike of nearly 100 cases since last week. Health Minister Pankaj Singh has also urged calm, asking people to not worry or panic. This is a virus that is not so severe in its strain. That's what's been told by doctors, of course, pushed and propagated by some politicians as well, because we saw the first 3 rounds of COVID-19 that hit India. There was immense panic. Unfortunately, many died as well. So this is a reason of concern, but doctors constantly saying this is not severe. Finally, Karnataka, first COVID fatality has been reported in Karnataka. 1 death in the last 24 hours has been confirmed. 85-year-old woman from Whitefield who died with multi-organ failure. She was tested of COVID just a few days ago. Currently in Karnataka, 35 cases, largely 32 of them out of the 35 from Bengaluru alone. So you had Dinesh Gundarao also reassuring nothing to panic. Listen in.
No, we don't want anyone to be in the panic, because whatever cases that are there now, around 45, 46 cases, all of them are all, with home isolation, with no other serious condition, no need of any ventilators or ICU or even oxygen also. So it has been, so the symptoms are not very severe, and the infection is not causing any serious problems for them in terms of health. So that has been the outlook so far. At least we can start monitoring and testing more. And then we will see. We'll go on a day-to-day basis, looking at the data and looking at information from within the state and from Government of India also, and then take further steps.
अपने दिल्ली की जनता के वासियों को बड़ा सप्रेम बताना चाहता हूं कि कोरोना से घबराने का कोई भी विषय नहीं है। अभी तक से जो भी पेशेंट आए हैं वो नॉर्मल सर्दी खांसी लेकर आए हैं, इसलिए ये कोई पैनिक की चीज नहीं है। और ये जो वेरिएंट दिख रहा है, ये अपने आप धीरे धीरे अभी तक की स्थिति में वो सिर्फ एक वायरल के रूप में आया है। किसी भी लोगों को इससे घबराने की जरूरत नहीं है।
Now, one must know, while if this is not a repeat of 2020, health officials are asking citizens nonetheless to follow basic precautions, wear masks if symptomatic, maintain hygiene and keep a close watch on vulnerable family members. The virus, well, even if it's not severe, it is multiplying. It's infectious for certain, so better be safe than sorry.